love mouth tape.
If I don't mouth tape, 12 hours of sleep is not enough. Everyone's so worried about quantity when we should be worried about quality. 8 hours, or I get 10 hours every night, but I'm still tired. Why are you still tired? Your body needs to be into a deep stage of sleep in proper alignment and with, if you need, mouth tape or even the mouth guard. What's going on with you right now?
I got in a car accident in May. I got this little twinge in my trachea here by my neck.
All right, so we're going to start with the vibration gun. So whenever you use one of these, you just want to go very nicely. You don't want to dig in. Now we're going to do some cupping, and this is just going to cause controlled chaos. Now your body has to send all these helper cells to figure out what's going on here.
I know my hips are a problem, but that's my biggest concern right now.
All right, so let's get you fixed up. So mostly in here, the wraparound back pain that people get is typically from the QL. Right here.
Oh,
She didn't even put the needle. All she did was touch you, bro.
Right here.
that whole region.
This is a big culprit, this area.
Podcast twins, we're taking you inside the body.
Yeah. I mean, I think everyone should try this before surgery, before injection.
Podcast twins, and we are not in the twin cave, but before we introduce Ariana, Vince, go ahead and do your thing.
Well, you guys know how much I love being on location, so today is going to be an awesome day. But of course, we have to start it out by reminding you, just like a couple of my friends last week, they forgot to subscribe. So I really want to take this time to ask you guys to subscribe right now. Go ahead and click like, share, and send it to one other person, because that way we can get this thing out to more people as we need to, so they can find out about all of this wonderful stuff we're about to talk about today.
Before we even introduce Ariana Fontenot, Dr. Ariana Fontenot, and show you her books and tell you how she helped my son, and then she's going to get into some hands-on stuff. We want to thank Social Arts Studio, our good friend Ariel Levitt. We're up here in Boca today. If you need some place to shoot a podcast, she's got multiple rooms. You should definitely check out Social Arts Studio. So thank you again, Ariel.
Big time, thanks.
And then now we have Dr. Ariana Fontenot. Thank you so much for joining us.
Thank you for having me.
The company is Slight Motion PT. The first book, which we actually debuted on the On Par podcast a year ago, I want to say.
Yeah, it was
it's called
about them.
Pain Proof, Habits to Get You Out of Pain. And now you've got a new book.
Yeah.
What's up with the new book?
So the new one is called Pain Proof Kids, because everything starts at childhood. And if we could just become a little bit more aware, we can stop a lot of the problems before they start, so that you not be dealing with these degenerative problems.
Or if you're me, having your ex-wife take your son to the emergency room because he's got a pain problem that could have been fixed with ice and physical therapy, and then after spending a bunch of hours in the emergency room and getting really nothing done, and $750 with insurance later, Ariana is a concierge physical therapist. So she drove to my house, and I walked away and let her work on my 16-year-old son. By the end of it, he was feeling much, much better. And more importantly, she gave him a lot of tips, strategies, and techniques to not wind up in that painful situation again. So, thank you so much.
Hell, that ain't the only thing painful. The beginning of that story was painful.
The whole story was painful.
My God. But hey,
we don't want to dwell on that.
No.
We really want to get into some of the hands-on things that you do, and maybe even, share a couple of the other tips and tricks. Like when you came to our office of the Winners Award Group, Ariana told everybody there, like, unless you take your wallet out of your back pocket, which I have no wallet in my back pocket, is right here in the front.
Just me.
I can't help you. I can't fix you. So that's one. Now, that one I already knew, but there was about 7 others that I was like, oh my gosh. And then start reading the book, and all of a sudden it's like I'm sleeping wrong. I'm not using mouth tape. I'm not taping my nose.
I love mouth tape.
There you go.
I love mouth tape. It got rid of my CPAP.
Okay.
Oh, that's awesome.
Now we're talking.
Mouth tape replaced the CPAP. It is amazing. Only time I don't get in trouble, I do get in trouble, is when I don't tape Because then I may entertain some people
Yeah.
while I'm sleeping.
If I don't mouth tape, 12 hours of sleep is not enough. If I mouth tape, like 4 hours
Yeah.
is plenty.
It's amazing.
Well, I couldn't find a mouth tape that I liked because of my beard and mustache, but whatever, and it works, and I sleep. My REM sleep is better.
Yeah, everyone's so worried about quantity when we should be worried about quality. If you're sleeping wrong, it does not count. So it's kind of like people are like, I'm going to do 8 hours. Or, I get 10 hours every night, but I'm still tired. Why are you still tired? Like, your body needs to be into a deep stage of sleep in proper alignment and with, if you need, mouth tape or even the mouth guard thing that you were saying.
Right. And if you need all the rest of the tips, you could either hire her to come to your office and teach your whole staff like we did, or you could buy the book, or both. So you brought a whole bunch of needles. You got some cups over there. Yeah. What are we gonna do today? What's up?
Tell me a little what's going on with you right now.
Why? I got in a car accident back in May. I've dropped about 45 pounds, as you know. Carnivore challenge. Don't sleep on your carnivore keto challenge. I started lifting January 1st, so I'm 11, 12 days in, working out every day.
Let's go.
I got in a car accident in May, got rear-ended, not moving, basically out of that pain all the time, except now I got this little twinge in my track going here by my neck.
Yeah.
So other than that, I feel pretty good. My body's sore because I've been lifting, lactic acid. The only supplement I'm taking right now is creatine. So you tell me what I need.
Okay, so like one thing to note is a lot of the time the reason that people have so much trouble getting into the gym or continuing to go is because one, they're sleeping wrong, so they're already exhausted. Two, they end up getting hurt at the gym.
Whatever you tell me to do, I'm in.
So I have just 2 questions. Do you ever do this exercise at the gym?
Yes.
Okay, so this exercise is in my first book, Chaos. So if you had a full rotator cuff tear, this would just drop.
Okay.
So that's our test. So whenever you're
I haven't done any of those this year.
Perfect.
I've only done the front raise.
Okay, so
the presses and a couple of,
So okay, perfect. So never this. Okay. We want to start clean, healthy, functionally fit, pain-free. So you're never going to carry something like this.
Right.
So what is realistic is going to here.
Okay.
So, and then if you're going in here, you have to, and if you're going into a Y, that's fine, but your thumb needs to slightly angle up. And then I would keep anything in front of you, thumbs up.
Okay.
Right here. And then you don't want to go you kind of showed me that you're going to right there. I would probably keep it right below 90. Did you ever do this?
Yes.
Did you do this one this year yet?
I did.
Okay, so I'm not a fan of this. This is also in the book because you're never going to do this exercise in real life. This is how a lot of people hurt their triceps, their elbow, all that type of stuff. It's also a little bit of shoulder impingement. Okay. So a lot of shoulder problems start because of shoulder impingement. So if I'm going to test you for shoulder impingement, I just bring your thumb down, lift your arm up. I'm going to show you 4 shoulder tests. Rotator cuff tear, I go here, labrum, AC joint. So we don't want to do those things.
I got all that fixed.
Yeah.
All of it.
So you never want to do things that bring our thumb down, but also if you're not hugging a pillow when you side sleep, that's what you're doing all night.
All right.
And we just want to be mindful with some exercises. Like I see people doing crazy stuff that where their thumb literally, they have a weight and they're doing this. No.
None of that.
So those are going to be your main red flag exercises. Other than that, you can get away with things. It's kind of if it doesn't hurt, maybe it's okay.
Okay.
And that's why it's good to always have someone guiding you and stuff. But yeah, you definitely want to narrow down. Pain is like working out when you work out. You're not sore today, so when 3 days later, so you don't know you overdid it until 3 days.
Right.
But typically, we never want to blame exercise. And the big problem is that you got hurt at the gym because of everything you're doing outside of the gym. And then whenever you rest,
I think I got hurt in my sleep because I'm old. But
yeah, okay. So tell me. So you said you're just pretty tight up
it's
here.
kind of right in here, and it just kind of feels very tight.
Like nagging.
Very uncomfortable. Yeah.
That's fine. And does it shoot down the arm at all?
Not at all.
All right.
Yeah, right there.
And what hand do you brush your teeth with?
I alternate because you told me I should brush my left.
Perfect. So none of you, does any movements hurt or anything, or just it just feels like
it's
you're
there? Yeah, it's just always there.
Perfect. So whenever you take off your shirt and then you're gonna end up laying on taking it off.
Don't lose my clip.
Don't lose my clip. Hold that for a second.
Right. We're holding this clip while he strips down. But he's naked.
Well, this is the before pictures because we're just started.
Right.
So we already got the before pictures out there, so they already seen this.
What is this?
Oh, that's an X39 patch. That's something I'm testing out.
1 to 10, how much is your Is it nagging you? Is it bothering you?
I mean, it's like a 5-ish, maybe.
Okay.
Maybe a 6.
So it's
or
all
five.
annoying.
Yeah.
Okay, cool.
And then the other spot I got is right back here on the shoulder blade. That's
Okay.
been like right below where my finger is.
Yeah.
Yeah, like a little lower.
That was
It's
intense.
Yeah, a
It's
little
because your
lower.
head's too heavy.
My head's
Your
too
brain's
heavy.
too big.
Oh, shit. Yeah, kind of like right in there. That's fine.
See.
That's fine.
Anything there?
I could be tense from time to time, but right now,
Yeah. So as soon as your baby is there.
That's why I carry my tension right in
Alright, I'm just gonna check out your spine.
face down. Yes.
Do you get your skin monitored by a doctor and stuff? Just like these little
So,
things?
no, I'll be honest, I haven't been to a general practitioner in like 6 years.
Oh gosh.
My chiropractor actually yelled at me for that. So at the end of the month when I get back from my trip, I'm gonna go. And then I'll give Vince and Dr. Bill and you my results, and you guys can tell me how bad I am.
Did you get any blood work?
Not at all.
Oh gosh. Everyone needs to get blood work at least once a year.
At least once a year.
Tell us why.
I mean, you're just gonna make sure your systems are all functioning properly. You could miss something, you know, maybe even like, let's say you're doing more protein, you could be like peeing it out on accident. Like, you know, that would be a big problem. That means your kidney function. You just want to make sure everything's okay. All right, so we're gonna start with the vibration gun. Basically, the body really likes vibrations, rotations, and oscillations, but a lot of people are using these wrong.
Okay.
So whenever you use one of these, you just want to go very nicely. You don't want to dig in. Okay. What a lot of people do is they'll press as hard as they can.
Yeah.
And that's just going to cause more bruising, swelling, chaos. So that causes a big issue. You just kind of want to be nicely gliding over. The body really likes the vibrational aspect. So it just kind of calms the person down. And yeah, so it's just really nice, chill, don't dig in.
Yeah. Okay.
A lot of people show me their bruises that they left themselves from digging in. We do not need to destroy our bodies. Pain doesn't mean we're winning, right? A lot of people, I feel like, treat everyone like pro athletes. We're not pro athletes. Right. We want to be functionally fit, healthy, pain-free. So we need to stop thinking that, like, we need to do all the things they're doing. And, like, it's just like a different category. We want to start just thinking, okay, like, how do I calm my body down and make it continue to win? And so I like soft tissue mobilization, but a lot of the times whenever things are already compressed, like, so right here already has swelling, it's already irritated. So if we just spend an hour pressing on it, that's going to be kind of a problem. So we want to kind of like loosen it up, move it around. And yeah, of course, hands-on feels nice, but massages should be relaxing. You don't need to go through like a crazy sports massage because whenever you're going through a sports massage, you know, that might be a little much for your body.
Right.
Our body just like, we can't just like pull in places.
Right.
What it happens is it adapts through all of our habits. So we just want to make sure all of our habits are good. Like how you sleep, work, relaxing it around. If you're sleeping wrong, as we discussed earlier, nothing else matters. But when people are hurt, guess what they do more of? They relax.
Really relax, yeah.
And whenever people are relaxing, typically they're relaxing on a couch. And couches are killer.
Yeah.
And when you think back, most dads had lazy boys on a swivel mount.
Yeah.
All of our grandparents had rocking chairs.
Yeah.
An object in motion stays in motion. You rock a baby to sleep. Mm-hmm. They help with anxiety. There's studies on veterans. They help with addiction. They distract your free brain. You get passive strength gains and passive balance gains. And that is critical, especially as we age, to give us, and you're moving, right? So if you watch a movie on a couch, right, after 2 hours, you'd be like, wow, I did nothing. Right. But if you watch a movie on a rocking chair after 2 hours, you'd be like, I got a free 2 hour workout. All right. So now we're going to do some cupping. Have you heard of cupping?
Love it.
We're the podcast twins. I'm Drew. That's Vince. Gold and silver aren't just history. They're security. That's why we partner with Miles Franklin.
And if you just call 952-929-7006 or email them at info@milesfranklin.com, tell them that the podcast twins sent you. You'll get preferred pricing and you'll get very well taken care of by them.
Real talk, real value, Miles Franklin.
So we're going to put some cups on. Basically, it lifts up the skin to allow improved blood flow or promote revascularization. I pulse around a little, so I kind of like pinpoint spots that I want to run it over. And this is just going to cause controlled chaos. So the way that I like to think about it is if you had an ant pile and you put food on top of it, you know how the ants would come right down the food? Mm-hmm. Now your body has to send all these helper cells to figure out what's going on here. So over the next few days, your body doesn't just change colors, your skin changes colors because your body's reacting.
Okay.
So now all those colors that you saw, all the hickeys, your body has to run and send helper cells to heal the area. Are these okay? And if they pop off, don't worry, they all break.
So typically, I've done cupping at an acupuncturist, and it seems like these feel a little lighter. So are they squeezing me too hard when I've gone before, or are you just going light on me?
Everyone has different opinions of what to do and stuff, but I don't think that things in life need to be painful, especially because we're not pro athletes.
Okay.
This should be relaxing. Like massages should be relaxing. Like a lot of the things that we're doing to benefit our body should have calm us down, not develop more like tension and stuff. So yeah, so I just leave these on about 3 to 5 minutes. And like you just said, if you were at a place, they'd probably leave them on way longer, but I don't have time to waste in a session.
Right.
Like effective dose is kind of 3 to 8 minutes, the latest that I've read or seen. So that's why I like to get all the body's defense mechanisms, right? So this is just one tool in the toolkit.
Right.
And then we do the rest of the tools. And that together causes our bodies to send all the help we need to heal quicker.
Okay.
Rather than just like an hour of straight massage, it's just one tool.
Right.
And that's going to send different mechanoreceptors. Vibration has certain mechanoreceptors that your body sends to that area. This does as well. It's pretty awesome. You feel pretty immediate relief. So another cool thing I've discovered is there's so many people are getting skin tagged or skin cancer things removed, right? And maybe it's lost in translation. No one's telling them they need to work on the scar once it's closed. So what happens is they're not touching the scar, and now the scar is this much less skin everywhere else.
Right.
So I'm noting that people's pain comes close to the time that the scar ended up like healing, like within a month after the scar, they'll get like a more flare up. And it's not that the scar is the problem. It's that if you have these scars, you can get away with that much less error.
Okay.
Because our body is one connective sheath from the top of our forehead to the tip of our toes. So if we have that much less room for error, we're going to get hurt with the things we're doing every day. So we definitely want to like desensitize scars as soon as they're closed.
And how often would a session like this be?
So for my clients, everyone tries to buy like a 10 session package for me. I don't sell packages because typically if I have to go back like 3 or 4 times, it's because either they didn't listen or they didn't buy what I said they needed to buy.
Right.
So they won't have a laptop stand, or they'll only have one pillow in their bed. And I really just don't have time for people who aren't going to listen. Like, I want to save the world from pain.
Right.
So if you don't want to get better, and it's okay for people to like not want to sleep the proper way, but that means that you belong in a physical therapy clinic with a physical doctor of physical therapy guiding you through exercise 2 to 3 times a week.
And sleep.
And that way you get stronger. So you can have like this much good and this much bad, right? So if you don't want to sleep properly, you need to start going to the gym and making up for that. Okay. So it's kind of like playing a game with yourself. Okay. But there's so much room for success. And once someone has like at least the foundation, every step they take throughout the day or every exercise they do at physical therapy is going to benefit them. Okay. Whereas if you're going to physical therapy and then you're going home and sitting on a laptop like this, you're undoing everything. So like my favorite thing is like everyone's trying to do 1 hour of exercise to combat 23 hours of habits. If we change our habits and we just become aware of them, we change our life.
And some people only want to do that 1 hour every 3 days.
Exactly.
So I'm like, how's 3 hours a week competing with everything you've been doing for 24 hours a day? So yeah, so it's kind of like I turn people's entire day into a workout though. Okay. So like everything you're already doing, I just show you how to do it better. Okay. And I kind of like move it. So for example, do you have an adjustable desk? I don't sit at a desk. Okay. Yeah, so I'm good. So if you did have, so this will apply to you. We want to think of our spine like a tree. Okay. If you hit the same part of the tree over and over again, the cut's going to get deeper, the tree will eventually fall. Right. If you hit the tree a little higher, a little lower, the tree has time to recover. So what that means is everything in life that moves needs to move. For example, when's the last time you moved your car seat? Nah, I kind of like it where it is. So yeah, you're right. So every 20 minutes, you should be moving your car seat a few degrees forward, a few degrees backwards, a few degrees higher, a few degrees lower. Constant movement, because then instead of getting into the same car and having your hip at the same exact angle and your body at the same lean, at least it's these micro movements that'll change things a little. So it becomes like a workout throughout the whole time.
I'm really glad you said that today, because that applies to me on Monday when I pack up the whole showroom and drive the van, driving a moving van up to Orlando. Now I'll have to be adjusting my seat.
So I'd be curious. I'm gonna have you get up real quick. I want to see how it feels versus before we start, and then we'll do the next part.
Yeah.
So just to like get an idea, because I feel like for me, like I noticed significant relief by just cupping, but I like to see in different
Okay. So
levels.
what's the question?
How does it feel any relief?
Yeah, it feels a little looser.
Like
right?
the
Yeah,
level.
it definitely feels. It feels like it's loosened up on both sides.
We're gonna loosen it even more. I just like to kind of see where I'm at so that we can notice. I love to like test things, right?
Mhm.
So I have like this other little pointer device that I'll see before I touch people. I'll just use it and see what they say. And typically, like they'll be like, "Oh wow, I feel a really big difference already." So I think that's pretty cool. Just like kind of collecting your own data and figuring out what works.
That's kind of like our diet, right? That's kind of the way we eat. That's what we're doing.
Figure out what worked and get out there and make it do what it do.
Okay, so now we're gonna do dry needling.
Yes.
Which sounds very scary, and a lot of people are like, "Oh my god, what's that?" Basically, same needle as acupuncture, different concept. You're going into the muscle to affect the muscle.
Okay.
Whereas how I would see it is like in acupuncture going into the toe to affect the liver, or you're going somewhere else to affect something. I'm finding the exact trigger point, and I'm going into that, and I'm causing it to contract and relax and releases a bunch of chemicals. And the only reason I found that it doesn't work is because people go home and keep doing what they're doing.
Okay. They don't change the behavior.
Yeah. So like, let's say you have like a shoulder. Let's say you have a shoulder problem, and then the next time you go to drive, you go and drive like this again, and it's gonna tighten back in the same spots.
Right.
So the key to everything is like right after this. This is when you have to be on your best behavior. Not tomorrow. You want to start like right away, be like, okay, let me just be a little bit more aware. That way, when everything settles in, it settles in the right spots.
Okay.
And so a lot of the times with a wrist or an elbow injury or anything or pain, I'll always start by treating here. And if I press hard enough, I can recreate their symptoms because typically it all comes from here. So the reason that people aren't getting better, that have carpal tunnel, that have lateral elbow pain, is because everyone's treating the elbow and the wrist.
Okay.
Everything starts at the spine. Everything starts up here. And there's these cool referral pattern charts that are actually so cool and they make so much sense, especially for like sciatica. Typically it's starting like right in here.
Yeah.
And so if I press hard enough, it'll recreate their exact symptoms. When you go into the needle, you cause it to contract and relax, and it dissipates the pain.
So how about for those that don't know, what exactly is sciatica and what causes it?
So there's a lot of, I pretty much think everyone with low back pain that shoots down the leg is going to call it sciatica.
Okay.
So, we kind of just, I don't like to correct people. It's can we fix the problem is the main question.
Okay.
And it's kind of where a nerve gets entrapped and just gets very irritated, and that shoots down the leg, and it causes this pain. It's debilitating. Sometimes people can't walk, like you said, it shoots. And the problem is that when you go inside, right, what you would do is you'd rest more.
Yeah.
So you'd probably coop yourself up in the bed, or you'd be on a couch somewhere without knowing that like these are the things that are going to keep you down and out. So this is the needle.
All right.
And so we find the trigger point in here. So right in here.
That's
Yeah.
That's it, Drew?
Yeah.
And then we just go there. So you see that contraction? That's
I
what
saw
they want.
that.
So you can kind of get the contraction. So this is one way to do the dry needling. This way you'll get pretty sore. It works really well. But what I like to do is I'll find 4 different spots and I'll attach it to a TENS unit. And then we'll run the TENS unit for a few minutes. And that's a little bit of a nicer way to do it. You also get more spread.
Okay.
So we don't want to like torture people. There's some people that like hated dry needling because whoever did it was very aggressive and rough. I found I get insane results with being nice. So and you can always be meaner later, but we don't need to make someone so sore they can't move. Right in here.
Yeah.
He couldn't even breathe when you touched that spot a second ago. Look at that.
Feel anything there?
Oh yeah.
Oh yeah. He's
Anything down the arm or?
No, arm's fine.
Okay.
But I definitely felt where you were pressing.
That's awesome.
Right here too?
Yeah.
And you see how that made his arm just like, this is his external rotators. So whenever you get on the right spot, like it'll just like jump.
Oof. Now it's kind of feeling down my shoulder a little bit.
Yeah.
To my arm.
Yeah, that's gonna mean we're on the right spots.
Ooh wee.
Yes, sir.
And then just one more. So hand me one more.
I'm loving this, by the way.
Yeah, fun, Vince.
I'm having a blast.
Amazing.
Well, that
first body.
When I-
Yeah. Vince has been drooling for weeks since we scheduled.
Oh yeah, I've been waiting.
Amazing.
This is right.
He's like a 7-year-old schoolgirl.
Yeah, pretty much.
Like the first time he told me he loved carnivore. And then I acted that way.
It was.
I mean, whenever you made me dinner, that was so freaking good.
Oh yeah, that was the night you fixed Nick's problem.
Yeah.
I was making burgers that night. Big surprise, right, Vince? I was making burgers.
Hey, that's what we do.
Keep them on the scene.
And yeah, I used the same recipe that I made the steaks at your house, Vince. Salt, pepper, a ton of butter.
And inside it, there was like cheese built in or something.
Well,
Or salt built in.
There was salt.
salt. Yeah.
There was salt.
I'm going to turn it on. I want you to handle it as much as you. Oh, sorry, I wasn't cheese. My bad. Carnivores don't do that.
Oh no, we do.
No,
we
we-
do. We're not lying.
We're hybrids.
We're not lying. Oh shit!
Yes.
So
That
I'm
must
just
have
going to
been
turn
that.
it on. And
She turned it on.
you know?
Yes.
Yeah.
No, you maybe turn it up a little.
Okay, I'm going to turn the other two on, and then we'll go back to this too.
Yeah.
And I want it to be relaxing enough for you to be able to breathe perfectly fine.
Is my muscle supposed to be?
Yep.
All right.
Your muscles are going to drop like that, and it's just going to kind
You see it,
of
Joe?
fatigue them out. So they're like guarding a lot of the time. You want them lower, or?
No, that's probably pretty good.
Yeah.
Okay, awesome. So we'll just leave that there
I
for
love
a
it.
little.
I love it.
So they're just like twitching. Sometimes if the severity of what you feel with the needles kind of varies depending on what you're feeling in real life, right?
Mhm.
So if you have complete numbness down the leg, it's probably going to be a little more intense when you do the needle.
Right.
And
Okay.
cause that muscle to contract a little more.
Okay.
So it kind of varies, but none of my clients really ever have a problem. They're chilling. A lot of people fall asleep.
Okay.
So it's pretty fun.
I'm okay.
And this burst is one.
I'm watching this here now, and I'm like, man, I should have been the dummy on this one.
Ariana said we got
Yeah.
time for you.
Yeah, that's awesome, man. I do the electric stickers.
Stim.
Yes, tech.
Yes, this
So-
is a tech unit that's
so,
just
yes.
like a jumper kick.
So I do that at home because I just had an oblique issue that was insane.
And how do you sleep at night? Stomach back or side?
I am a stomach sleeper.
Oh, you're in trouble.
I gotta tell the truth, man. I gotta tell the
Hit it,
truth.
read your book.
I start on the
Yeah.
left,
Hit it, read your
and
book.
then when I really get cruising, I roll into it,
Yeah,
and
check it
I'm
out.
slide. I'm a face guy.
Oh gosh, no wonder. That's just you're waiting to get hurt.
Yeah.
I believe you, because sometimes I wake up and my lower back feels like it's in a knot. Put the
So here are the proper ways to sleep.
Okay.
Side sleeping. So you want one pillow on your head, never more than one. You know who puts more than one pillow on their head?
Ooh.
Grandma and grandpa who walk like this.
Okay.
Well, yeah.
That's their spine didn't just get that way, it got that way because of habits.
The kyphosis.
Yes.
All
And
right.
then you need one between the knees, full length of the knees, no body pillow, no mini pillow. One between the arms, one behind the back. You can replace any pillow with the person, and you need to give yourself a posture check before you fall asleep. If you're sleeping wrong, nothing else matters. That means every step your foundation is already cracked and broken. Every step throughout the day is tearing you down rather than building you up.
You gotta learn how to sleep, bro.
I know. I listen. I believe that because sometimes, because I do have two pillows.
Under your head?
Yeah.
Until today.
Under the head edge. But if sometimes I wake up and I'm very tight down here and in the lower back region because it concaves the wrong way.
I can tell you put two pillows under your head.
You know. See, just right there.
Sleep nightmare with more than a pillow, even touching another pillow.
I am a sleep nightmare.
You know who also sleeps on their stomach? Most of my what I found is the people I know with plantar fasciitis,
Mm-hmm.
they're stomach sleepers.
Really?
Yeah, have you ever had it?
I popped it.
Mm-hmm. Okay, so if you think about it, if you look at his legs right here,
Mm-hmm.
if your stomach's sleeping, your feet are stuck in plantar flexion all night. So your calf's passively shortening. And then when you go to take your first step, that's why it's so painful, because you've been shortened all night, 4+ hours. And then the other habits I see them do is typically at their desk and stuff. They're not typically a feet flat person. they'll be heels in the air type of person.
Okay.
So they'll sit a lot like this and all these other things. And I'm in these Facebook groups where I just try and like help people who are miserable.
Right.
And so many people message me after the next day of literally not sleeping on their stomach or like being aware not to point their feet. Because even if you're a side sleeper or a back, you could still point your feet. Whenever they're aware of not pointing their feet, they'll wake up the next day with no pain and they're like messaging me. They're like, how did no one ever tell me this? I went to the doctors, to tons of doctors, all this other stuff.
Yeah, well, we got special feelings for general doctors. So we like physical doctors. We like PT docs. We like chiropractors. We like people that put their hands on you and fix you, as opposed to writing these pretty little things on these pretty little pads.
Yeah, it's hard. That's how you get paid by insurance. You write the pretty things on the pretty pads.
And
You're still
that's what we hate.
here, so it doesn't matter.
So, but yeah, no, that made a ton of sense. I was out there sprinting one day, just out there by myself in the park, and it went pop. I thought I got shot from somebody. It felt like I was really afraid I popped my Achilles, but it was the tendon on the bottom of my foot, and it just snapped completely. And then by the time I made it to the doctor, his statement to me was, after he thought the MRI, he was like, well, you already did my job. There's nothing I can do for you.
And I will slowly let me win. There you go.
Wait,
so this is going to decrease some of the soreness.
Yeah, I felt the crack already.
Yeah, and the other thing, do you have any foot or ankle or knee or hip problems right now?
No.
Okay. So another big thing is that shoes that don't tie, and I wore them on purpose. Shoes that don't tie are destroying people. Because not only in those shoes, since they're not tied, are you having to carry your foot, you're carrying a whole shoe. And I've saved a lot of people from ankle surgery. Hold this up and slowly, just like here, and slowly let me win. By just getting them to wear shoes that tie. Because if you're not tying your shoe, that's causing chaos every step.
Okay.
And these ones that I have here, you can move towards getting up slowly.
That's what I have. That's what
I have these here.
100% of the time.
Yeah, so the thing is, nothing matters till you get hurt. Once you get hurt, these are all the reasons you don't get better. And a big reason is that people are wearing these. And this is like, just every step you take, it's just imbalanced. So you definitely want to get on shoes that tie.
Oh my goodness.
Yeah.
Like, I'm not just saying this, but that's pretty damn good.
Yeah.
Yeah. And so the last thing I do is
I feel like a bump there now too.
Yeah. There's like, you said like a what?
A bump.
Yeah. So remember, you just caused like some chaos.
All right.
So now your body over the next few days is gonna heal it. You want to. You can ice if you need to.
Okay.
Anything, it's gonna be normal to be sore. You just basically gotta work out. Every time that muscle is contracting, that's your muscle contracting and working out.
There it is.
Right. That still doesn't count as my workout.
No.
I got.
You're gonna tell me he was doing shrugs or something?
Yeah, it is shrugs.
We're just gonna do a nice.
Physio.
I probably should move around so we can actually see this.
Yeah.
I've never held the microphone.
Yeah,
People do it all the time.
Yeah.
I've never held the microphone before.
I was just trying to figure out if we can clip it to your beard, maybe.
No. I should have put my chain on today.
So I'm just gonna cut some tape. So the tape is amazing.
Yeah, it feels pretty. I mean, it's a little tight,
But
that's because it worked.
She caused some chaos in there.
Yeah, we like controlled chaos. That's my favorite.
Boom. I like it.
Okay, so now I'm just going to tape you. Basically, this is just going to kind of remind you to stand up tall. It's going to get... The other thing is that, like, the tape being on your skin, since it, like, retracts a little, it allows, a channel for blood to flow and stuff. I have some really cool pictures of how quickly it heals bruises, too. So you're just going to hike this shoulder up there. Perfect. And now you can relax it.
Okay.
I stopped it right before your little thing. Tape can stay on... about 3 days, probably, would be the good amount of time. And this is just going to remind you you're healing and get your body to kind of stay more upright rather than looking down, too. And squeeze that back.
So I'm trying to remember who the tennis player was that kind of first came out with the physio
And
tape.
relax.
And the whole world was like, oh, does it work? Does it work? What is it? But yeah, listen, it wasn't until I had it applied.
Male tennis player or female?
It was a female.
Female tennis
Yeah,
player?
and I can't remember who it was.
Okay.
But it was more than 10 years ago.
So that's it. I'm done.
Yeah. So like we give you a few other things.
And teach me how to sleep.
Teach
You
us.
already told me I need a laptop stand. I get
Yeah.
it. I know resistance bands are big on.
Yeah. So we would go over it in like, oh, and I also got these from some amazing
Yes.
place called Winners Award Group.
Right. There you go.
And I give my clients all these. So I was giving them just hair ties. It was like, why don't we brand them? And whenever, instead of leaning in the car, you just do this. So we got that one.
So we're going to be doing these in the
So
car.
it's kind of like you want something to do. Like if I'm in line,
Right.
I'll just play with this. We're always gripping, right? So everything you see is like a stress ball, a grip, this, that. We're never getting blood flow to our extensors. So this is really good to get blood flow back through our body all the way to our fingertips and to our extensors. If I get like a dentist, they'll have trouble doing this. And dentists have a huge, really high rate of wrist pain, elbow pain, neck pain, because they're always at these weird angles.
Right.
And it's a huge muscle imbalance, right? If all you're doing is gripping all day, every day, it's a problem.
Yeah.
So we kind of want to balance everything out.
Oh, we used to use rice to do the exposure.
Oh, yeah. So a lot of
rice.
the football players that I've spoken to, they used to play with their hands in sand.
Sand and rice.
Yeah.
All right.
You feel the feedback and everything.
Push out, you pull in, push out, pull in. Baseball, football, same thing. Push basketball too for their palm grip.
Mm-hmm.
So
And it's kind of fun because you can't just take away habits. You have to replace them. So we can't just be like, I can't just be like, don't sit like that.
Right.
But if I'm like, oh, instead of sitting like that, whenever you feel the urge to do it or you catch yourself doing it, just do this.
Yeah. Well,
it's all the little things.
Doc just hooked me up because he was like, when I was getting adjusted the last time, he saw me laying there on the table. He said, when you're driving, your leg kicks out like that. No, it just leans. It's just a natural thing. And he's like, yeah, I've been doing it for so long that now you literally have to make yourself stand straight.
And guess what? When you sleep, what's easier to fix than driving? Sleep.
Sleep?
Whenever you sleep, there's no way your leg's just like that, right? So it's going to have to be like that.
Yeah.
So we have to get to like the main root of the problem, not like the symptoms. Everyone wants to say, oh, your cellus is tight, or oh, you have anterior pelvic tilt. These are normal variations, considering that there's 23 other hours of the day that we're doing all these things.
Yeah. Yeah. I mean, we are moving. But again, like you said, we repeat a lot of the same movements. So in the gym, we will see people that love to see, because you can see the chest in the mirror. Nobody works their back. They don't work the quads, but they don't want to work the hamstrings.
Yeah.
So you will see that imbalance going on. And then when they go out and run, your quads are 6 times stronger than your hamstring.
You got a guy that just works upper body and he's got like skinny legs or something.
You mean like everybody in the gym today? Everybody in the my post today said, fellas, y'all better figure out where the squat rack is and the leg press and other leg machines, because these women are kicking y'all ass. I literally, that was my post this afternoon. I'm like, all these ladies are just in there grinding it out. Great development. These guys are wearing sweatpants. I'm like, that's what happens when your ass got skinny legs. Yeah. You know? So, fellas, we'll tighten up.
And give me a couple of days and I'll tell you how I feel. But I feel pretty good. I feel better than I started for sure.
Yeah. So some other cues are, meatheads, they walk around the gym like this.
Yeah.
So they're bringing their whole body forward, they're tightening their pecs. We want to karate chop through life. So more like here.
But that's a lot of times because the chest is way stronger than the back.
Yeah, exactly.
So it's rolling them forward.
Yeah, and then whenever we're sitting, instead of sitting palms down, we want to go palms up.
Okay.
That way you open up. And in yoga, if you think about it, you do this, so they don't have to say palms up, right? You already know to put your palms up. So it's these little cues that,
Okay. All right.
Well, enough about me. How about Vince? What about you, Vince? What's up, man? Tell her what's up.
Well, I just came off the oblique, which it was horrible. Definitely, probably, I'll be able to play golf this week. I probably went better. And then the hip. That's it. I know I have tight flexors. That's because I used to be known as one of the most flexible guys in the world. But over the years, you just don't do it. And so I don't stretch them and exercise them or literally do the things that I used to do to make sure that my hips stay strong. So I know my hips are a problem.
Yeah.
And so that's my biggest concern right now. And so I've been doing a lot of making sure that I actually do glute training because that was a problem because I was starting to.
And do you use a band when you're doing your glute?
I've done
a
band. Maybe not every time, but I have.
Yeah, definitely want to do that. But everything you just said is the exact point of my books, is that you're saying that this 1 hour of exercise, it's because you're not stretching. It's because like you've aged in this way. But in reality, it's because you're sleeping on your stomach.
That too. That first.
So that's 8 hours, 4 to 12 hours that we're talking about in a day.
Yeah.
You're not moving the chair in the car. So that's one position of the hip. And do you watch any TV? What do you do at home?
Oh, yeah. Oh, yeah.
Where are you sitting?
On that wonderful, lovely couch.
Exactly.
You know, that I'm extended.
With the legs up. So all these things, we're fighting the wrong battles, right? And we're blaming ourselves for things that, like, oh, I used to be so flexible. If only I stretched more. If only I worked out more. If only I did this. When in reality, if you just sat in a rocker, you'd be stretching your hip flexors all night or all day while you're sitting there.
Man, when next time you smoke cigars, go back in the rockers.
You gotta be in the rockers.
I like the...
So,
listen, sleeping on the stomach. And I will tell you this, I really think that it was probably because early on I was snore. And so when you roll over, it stopped the snoring or slowed it down or muffled it.
yeah.
So maybe I got into that habit of doing that based off of that before mouth tape. And so maybe that's what it is. Maybe that's why I created that habit.
Yeah, that's a good thought too. And it does feel like comforting and secure.
Okay.
So ideally, you really need to figure out how to not stomach sleep. I know it's comfortable, but once I show people the 4-pillow method, 4-pillow fortress,
right,
that feels even more comfortable. And it's okay to like half stomach, so you can like put a pillow here and here and turn half to your stomach, as long as you're not full stomach. Because for me, for example, I dislocated my kneecap. And I could not stomach sleep for like 2 years after that. I couldn't even lay on my stomach.
Right.
And now if I do lay on my stomach, I'll wake up with like a little bit of knee pain. Because if you have no cartilage in your knee and your stomach sleeping, you're pressing that kneecap with no cartilage into the bone all night. And so of course it's going to hurt in the morning. Of course it's going to hurt throughout the day. And it just is like a broken foundation. So now when you're walking throughout the day, you accidentally misstep and you're like, oh, all I did was take one wrong step, but it's been building up for 4+ hours for the last however many years of your life.
Okay, time to stop that.
So, I'm one the head, one between the knees, one between the arms, one behind the back.
What about if you're a back sleeper?
So back sleeper, only one pillow on the head. You want, and ideally a small one. They make the ones with like the cove.
Right.
But the cove ones are not good for side sleepers, so it's kind of hard. And then you want to slide one under the knees.
Under the knees.
And if you cross your arms on your chest, you put one on your chest. Because you don't want to be here. You want to be here. Because it's going to tighten you up all night. This will open you up.
Mm-hmm.
So, but the latest research is side sleeping's a little better.
So it's 3 pillows if you're on your back.
Yeah.
4 if you go
And then if you're on your back and you decide to turn to your side, you already have 3 of the pillows.
And those cove ones you call it, those are not good for a side sleep.
Yeah,
Because they have like the thing in the manual when you open the pillow up that if you hold it one way, if you sleep on your back and then you flip it around, then you sleep on your side. But you're saying if you're on your side, you really want just a regular pillow, not the cove.
Yeah, they have like a one that's more like that for the side. It's really what works for you.
Okay.
But what I found, and it's crazy because the picture on Amazon of the cove pillow, I guess we'll call it, is of a side sleeper. Mm-hmm. So it kind of throws things off, but I think nothing's like one size fits all for pillows when you sleep. For example, some days I use a bigger pillow, some days I use a smaller pillow.
Right.
Yeah. Like my body just feels different days. So I have 4 different pillows and I put them wherever I feel right. I think that the problem is we go home and do the same exact thing every single night and sleep in the same spot with the no pillow.
I have the 2 pillows because when I side sleep, because of the size of my shoulder to head ratio, it fits.
Yeah.
2 pillows.
So you need to get a thicker pillow because what happens with 2 pillows is you get micro tilts. And I treat a lot of like migraines and headaches and neck pain. And as soon as you get them off of 2 pillows, they get way better because the 2 pillows don't match with each other, I guess you could say. So your head will be here, but one pillow will have like this tilt. So it'll just put you at these weird positions. A lot of vertigo as well.
Okay.
From what I see, is these micro tilts. So it's not even, so it starts with the pillows.
Right.
But another thing that you'll see a lot with migraines and that type of stuff is going to be instead of their main monitor being directly in front of them, it'll be slightly off to the side. We need to center things and we need them to be 30% above eye level. not
Okay.
at eye level.
Right. To keep them from doing this.
Yeah. So a lot of people are like, oh, I want to be at eye level. No, 30% above eye level. If you don't have a stand under your desktop or your laptop, that's a big problem. Because they don't typically go high.
Same thing with reading a book or being on a cell
Reading a
phone.
book, yes. So how do you hold your phone? Do you have one on you? I don't have it.
Well,
Mine's
yeah. Well, at home, I actually use a tripod.
Nice. I get all my clients to buy like that.
I use my
Yeah, I have a tripod.
because you told me to.
Well, I did that just because I got conscious of doing this.
Yeah.
So if I'm at home, I'll put it on the tripod.
Amazing.
Most times. Then, of course, the red light check. You gotta have the red light check. So that's a down and to the side. You know,
Yeah.
that's honest. That's a red light check. So, but yeah, I normally I try to put it on the tripod, and I have a little stand on the back, so even if it's on the desk, it might be lower.
Yeah.
But I'm not holding it and doing that.
So right here, 60 pounds on your spine.
Yeah.
Every degree up is critical. The
Yeah.
only thing we're still looking down is down to the side. So in public, somewhere here, at home, it needs to be up here.
Yeah.
And that was the big thing that she told Nick, my son, when she, left. Before she left, after we ate those burgers, she said, look, because of course she's in my house, helping my son. You're going to invite her over.
Yeah,
you
gotta figure it out.
Yeah.
Well, we're that's just we gotta feed people. That's how we show love in my family. So, yeah, but that was one big thing that Nick started, and I saw him start doing it like the next day, that night, but the next day at
The position these kids are in on their devices, like they'll put their head against the wall and they'll go here, and they'll be on their phone all day.
These young girls, we were hanging out with a bunch of my daughter's friends. She's 10 going on 11, so they're all like 9, 10, 11, 12, 13 maybe, and the freaking positions that they contort themselves onto when they're talking on the phone to each other, or like,
unbelievable.
I don't even know how they can function in
That's what this is about.
Pain-Proof Kids by Dr. Ariana Fontenot. It's your co-author?
Alicia Guido. She's
Alicia Guido,
Montessori. She's a school teacher. So
God.
and I did it together. Yeah. But we go over, like, everyone tells you scoliosis is genetic. They're able to contribute about 20% of it, out of all of it, to 6 genes, but that doesn't mean that the genes are causing the problem. You have a gene that can predispose your spine shift in ways, but it's because these people are leaning like this. My clients' spines match their exact same lean. Like, it is unbelievable. They're on the couch like this. They're in bed like this. And I treated a girl, and she's like, my mom does it too. And we do what our parents did.
Well, was it you who said that genetics is the gun and habits are the trigger? Is that the quote? Right? Okay.
I left that out of the kids' book.
But it's in your other. When I was reading Pain-Proof, I remember.
Yeah. So it's like, this is like how people are literally sitting like this with their feet on the couch.
Like one of my daughter's girlfriends was literally worse than that. Like, I was uncomfortable looking at her laying on the sofa that she was laying. Like, it hurt my neck and knees and everything just watching her.
Well, I have a sister that, well before any electronics came out, she carried all of her children on her left hip. And this
that's a big one too.
And so as she aged, this was a problem.
Yeah.
Like, literally, it was the lean.
Yeah.
And so she's had to go to therapy to try to get that.
Yeah, and so
fixed.
The reason, like, therapy is going to work eventually, but the main reason it doesn't work is because people go home and keep doing what they're doing. Yeah. So, like, we could hop on a phone call and I could probably make her accelerate her recovery so much more. The craziest thing that I've heard for scoliosis, because you can't just tell people what to do in these pages. You have to be like, how does your kid sleep? And then I can give them advice. Right. So the craziest thing, I was like, how does your kid sleep? Because I saw the x-ray. And she's like, crisscross applesauce with her head between her knees. And I was so shocked. And 5 other parents said, oh my God, my kid does that too. Do you think that could be a problem? And we cannot blame the parents. Sleep? They just don't know better. Yes, crisscross applesauce. Yeah. I don't even think But their head between their knees like this.
Oh my God.
Dude, if I went in my daughter's room and saw that, I would freak out. I would think she's possessed.
Yeah, that's what I'm waiting on the Exorcist to jump back to TV.
Yeah, the parents.
If her head starts spinning around, I don't know why.
First of all, I don't know if I could get my ass in that position, so that's worse. So you ain't got to worry about me doing that.
I mean, you're almost as bad with the stomach.
And I am. Listen, I have position 8 problem.
Wait till you stop sleeping like that, and then you can.
Yeah, I can't wait to see
into
that.
position A.
And we're below. Right?
All right, so let's get you fixed up. Where did you feel the most discomfort when you hurt your back and stuff?
The whole from here all the way around.
Okay, so that's gonna be your QL referral pattern.
It was horrible.
Right through here. Was it mostly the right side?
It was all the right side.
Okay, awesome.
The
We'll take
base,
care of it.
all the way around.
So I can have you. You're gonna lay on your stomach too.
Yeah.
And I'll just do a quick screen. And do you have any medical conditions? Anything crazy?
No.
Yeah. Blood thinners?
No.
He doesn't take nothing but steak. That's his medicine.
54 years old, no meds.
So mostly in here? Feel anything?
That's where it was.
And then what about?
Oh yeah. Oh yeah. Oh yeah. It's a ton better, but it was.
We'll make it all the way better.
He wouldn't even play golf.
All right, I'm gonna throw
He
some
said
cups
no
in
to.
it.
He said no to
All
golf.
needling, and then
I said no to
He
golf.
said no to golf. That's how hurt he was.
that's wild.
Now I get to watch what happened to me when I was laying down. So I don't think I've ever witnessed this before. I've had the treatment before, but I don't think I've ever seen it though.
Yeah, this is pretty cool to watch. I enjoy watching you.
This is
So the wraparound back pain that people get is typically from the QL, which is your
What's QL?
quadratus lumborum. And it basically the way that we think of it is that it's like this, it does this.
okay.
So if you're sitting in like this position, it's going to shorten on one side and lengthen on the other.
And all the stretching in the world doesn't fix the habit.
No.
Got it.
And that's what he kind of went through. He's like, oh, I don't do it as much. For an interesting one was I had a hockey player who had a hip flexor injury and it wasn't really getting better. It was taking a while. And I don't like when things take a while.
Yeah.
Like, we need to see results or we're missing something.
Well, I'm sure those hockey players want to get back on the ice too.
Yeah, and then it turns out that he was sleeping properly, but he was using a body pillow. So whenever you use a body pillow, it's not like I'd rather you use that than not. But when you use a body pillow, you have to curl down and you lock your hip inflection. We want freedom of mobility. So if I want my legs to be down here, I can have my legs down here. Whereas a body pillow, you're stuck here.
So body pillows are completely unnecessary and no one should ever buy them.
If you're going to use a body pillow, you can use it between your knees because I do like to have like a king pillow between my knees to be longer. Or with your significant other, you can both ride the body pillow. So
ride the body pillow.
I think even if one person back sleeps, that goes under their knees and the other person can hook.
Okay.
I need to do like a video on how to like co-sleep because it is very important. A lot of the things I'm always collecting data from every house I walk into. So a lot of the successful couples I see that have been married for like 30 plus years, none of them have California king beds. Most of them actually have queen beds because they say like the king bed creates distance. So like if you're mad at each other and you're on like a king bed, then you don't have to like be close enough to accidentally touch the person or to like make up.
So I this brings up another good point because my dog is a little guy. You met Max, 20-pounder. And he's running around. He's a good dog. Like he doesn't give us any trouble, but he sleeps. And if it's raining or there's fireworks or it's loud outside for whatever reason, he will crawl inside of my wife's back and basically try and burrow inside her back. She'll wake up in excruciating pain the next morning because Max ruined her sleep.
Yeah.
So do you tell people, and this is a tough one because people love their dogs in their bed. Do you tell people like get that dog a dog bed and put him next to the bed or put him or her at the foot of the bed? Like what do you tell them when they say, look, my dog sleeps in the bed with me?
We can't win every battle. So that's kind of like a way harder thing to deal with. I typically don't get there unless the other things don't work because you have to like pick your battles, right? Like if you're not going to sleep properly, you just need to make sure we need to be that much more serious about the other things, about the exercises, about the sitting better, about the movement. But it is interesting because I had a lady that had vertigo and it came out of nowhere. It's horrible. And we came down in the conversation, the session. I was like, oh, how old's the dog? She's like, a month. How long is your symptoms going on? She's like, about a month. And she's like, yeah, the dog just sleeps next to my head. So the dog would sleep here, so that means the head has to be in a different spot.
And that goes all out of whack
Yeah.
for 6, 7, 8, 9 hours.
Yeah, and then she's worried about something. Oh, like just move the dog. And when she moved the dog away from her head, she got better. So, I mean,
no dog in the bed.
yeah, I mean, I agree. My mom's an infectious disease doctor, so I'm kind of a germaphobe.
Yeah.
So I don't know how I feel about having a dog in the bed. It's probably pretty hard to keep the dog out of the bed, though. But animals are so crazy. And this way to tell people, like, random reward is the best reward. Like, where it's like someone can text you 100 times, and if you answer once, that's like their cue to text you forever. That's what I tell all my girlfriends. I'm like, okay, like, this isn't the guy's fault. Just you gave them random reward. That is the best for our brain. And that's what happens to dogs. Once you give the dog food from the table, the dog's gonna always think, ooh, maybe I can get food from the table.
Yeah.
And they don't learn as quickly as us. Well, I don't even know if we learn, but
Wow. Oh,
I mean, I think we're capable of learning and making small changes. And you this is not the first treatment I've had from you or my family's had from you. And we got a little more insight. And I did read your book on the plane when I went up to Las Vegas with my wife, because I was on the plane by myself and I had nothing to do but read and be on my phone. So. I have a little more insight into it, and I have made some small changes. We talked about the mouth tape earlier, which I have a mouthpiece now instead.
yeah.
And then the nose strips, which
So
I went through like, I don't know, 6 or 9 or 10 different nose strips before I found one that I
Which
liked.
one do you like?
It's I'll have to text it to you later because I don't remember the name of it.
Anything right there?
They're jet black.
Yeah.
Does that shoot across?
No, they didn't shoot, but I felt that one.
Sticking needles in this guy.
Yeah, I'm a dartboard.
What?
Have you had any dry needling before?
Do not dry needling. I've done
Acupuncture. Okay.
Acupuncture, pressure points and all that stuff.
Alright. Yes, that's
Yeah, now she cooking with hot grease there.
Right here?
Oh,
She didn't even put the needle. All she did was touch you, bro.
I will go right there.
Yes.
Does that shoot down?
Hey.
Hey,
That's the spot.
I'm gonna get this guy sleeping on his back or his side, and he's gonna be 10 tons.
Yeah.
We're gonna have to bring him to every charity golf tournament.
Yeah.
Because he's gonna be killing.
Right here.
Oh, that whole reach.
So this is a big culprit, this area.
Hey, Kirk, are you having fun, man? Having fun.
Anything there?
Not like the other spot.
It's just watch
there a little more?
Yeah. A little pressure.
Okay, now we're going to do one more.
Yeah, indeed.
Yes, indeed.
Boy, that person would say, good afternoon, good evening, and good night.
Anything here?
I'll go forward a little bit.
The other forward. That yeah, there you go.
Oh, yeah.
He meant right.
Right there?
It's not very good.
Perfect.
Direction.
And now I'll just attach the tens.
Okay. Yeah. Oh, she got my full attention.
I told you.
My full attention. Podcast twins, we're taking you inside the body.
Yeah. I mean,
You know,
this is the move.
we are working this thing for real.
I think everyone should try this before surgery, before injections. Like,
While you're working on Vince, let's talk about. I know both of these books, Pain Proof and Pain Proof Kids, are available on Amazon because I bought mine on Amazon. So how else is that the only way to get them?
yeah,
That's
so
the thing. So you gotta buy them from
Fine.
the big evil Amazon, but whatever, that's fine because we're helping Ariana.
You feeling
And
that?
then after you read it and it helps you,
That's good,
leave
that's
her
good.
a review
Me too.
so that other people can learn about this. That's why we're here,
Good there.
right? We
That's
want
right.
other people to learn.
Mm.
So, and
Yeah.
then what about if they wanna go through your full process at Slight Motion PT? How do they book an appointment with
They
you?
can either message me. Instagram is one of the best ways to do it at
Okay.
Slight Motion PT, or just shoot me a message. They can call me, but they gotta leave voicemails because I get so many calls a day, spam or real. But I'm only calling back.
So Instagram at Slight Motion PT is your
Yes.
handle. Easy to find you.
Yeah,
And you can book an appointment right through Instagram.
yeah. You can just message me. I want to make sure that I'm the best to treat you, so I do
Okay.
like to hop on a call and make sure that.
And how far, I know you like to go to the home or the office if it's a corporate event and you're doing a lot to help with like the team building and getting everybody healthier so they can be more productive, which makes perfect sense in corporate.
Yeah.
What about how far will you go?
So I go to California.
California's pretty damn far. I mean, we're in South Florida, unless you went to like Oregon or Washington or Alaska or Hawaii, I think that's pretty damn far.
Yeah, but in South Florida, I'll drive pretty much within an hour once because I don't think people really need more than one session from me because I know that I can help them.
Okay.
So it kind of depends, but then I can set them free. They can go to like a clinic to do the rest of their rehab. Once you have the foundation, it's a pretty good starting point. For companies, I'll just travel wherever. I do a lot of corporate ergonomics and life optimization. So a lot of the times, especially in San Francisco and California, when I treat someone and I'm like, oh, I'm a physical therapist, they're like, dude, you're so much more than a physical therapist. You're like, you just leveled my life up 100 times.
Okay.
If you could get less sleep, be more productive.
I mean, who doesn't want to be more productive?
And then the other, like, people are just, I mean, when you're in pain, you're going to be mean, irritable, and evil. So the whole team morale goes down.
Let's ask another question because we like to bring stuff back to diet a lot because diet, 85% of your success is what you eat.
Yeah.
And that's whether you're working out or, following the good habits or anything. So how important is diet in helping people with getting out of pain when they are in pain? And I can speak from my own experience. I know Vince has his. But from your standpoint, being a doctor and a holistic doctor and trying to get people out of pain so they don't have to come back to you 10 times, like you said, how important is what you're eating?
So I think it's super important, but that, it's so hard. You have only a certain amount of willpower for a day. And if you're sleeping wrong, it's going to be so much harder for you to make a healthy decision at work. Or if you feel like, oh, I didn't work out today, and that's your standard, then you're going to be like, okay, I can just eat whatever. But once we start getting away, okay, I slept properly, now I can make these easier decisions because they think that a lot of ADHD is from mouth breathing.
Okay.
Super high correlation. And so if you're mouth breathing at night, it's so much harder to make a good decision of what to eat in the day. Like, yes, diet's incredible, but another thing I look at before I drill people on diet too is where are you eating your food? A lot of my clients with reflux, they're actually eating on the couch. A lot of people with obesity are eating on the couch for a number of reasons. But if you're eating on the couch like this, your food's not going down well. So I definitely think that diet is critical, right? But every body's different and every body requires different things. So I do recommend a lot of people use like a CGM or a continuous glucose monitor.
Okay.
They're only $50 nowadays. You can get it for 2 weeks. You wear it. It teaches you a ton about how your body responds to the food you put in it. Because I don't think diet's one size fits all.
We wholeheartedly agree with you on there. We just want people to try carnivore or keto to see how it works.
Yeah, definitely should
Which
try.
is why we did the January challenge. We piggyback off of Dr. Sean Bayberry. Carnivore World Carnivore Month, and we're doing a podcast.
That's awesome.
We got 30 or 31 people doing it.
I definitely think that everyone should try different things and figure out which their body adapts best to. And anything that you get onto a new thing is going to be awesome. Yeah. All right, so you can slowly get up.
I could have got some good sleep right here.
I was going to say, you seem like you were going down for the camera.
My words had escaped.
I mean, see, so a lot of times people are very scared.
Really awesome.
Right.
They fall asleep right now. They fall asleep during it.
I could have absolutely went to sleep. Take time. But what I was, there are people that because of the eating positioning will eat standing up because of that fear of they ate and didn't feel like it was going down properly.
Okay.
They eat standing up. Literally at a chest high counting. Boom.
So when we're cooking,
yes,
cooking episodes, and we're eating in my kitchen or your kitchen, standing up.
Literally, but that's
is there something wrong with eating standing?
No, I don't think so.
I have no clue. That's not my specialty.
Okay.
But the most important thing about eating is walking for 5 minutes after you eat.
Yes.
We talked about
Yeah.
That would be my meeting.
I think I forget what this guy's name, but he would eat and walk for 15 minutes. 10 to 15 minutes after replaced I forget the name of that man. What's that? Metformin. It's for all the people that's taking metformin, if you walk within 10 minutes, 10 minutes, right directly after your meal, it has a much better effect on your blood glucose than metformin did. And that was it's a study.
Lean forward.
Absolutely. Yeah. She found all my spots, y'all. All of them. All of them. Because, man, when she hit me right here, that leg
That
didn't
was
go.
the best.
Oh, listen. And then when the little zzz started going down there, I was like, yeah, it was definitely a different level of wonderful.
And now move around a little. Tell me how that feels.
I can definitely feel it in here, right here.
Yeah, so it's gonna be pretty sore.
I am excited to.
And now you're gonna go home and sleep properly.
I'm gonna go home and get on my back.
He's gonna go buy 4 pillows.
He's gonna go buy some new books.
I have a ton of pillows, but I have to get the books now because I gotta get mine signed. As you know, I'm bougie like that. So
yeah, that'll stand up eventually.
Yes.
Oh no, yeah. It's unread. That one is unread.
But yeah, I enjoyed that because it's a different type of treatment. It's not like chiropractic, which is the manipulation. This is like when I say we doing inside the body, we went inside.
Oh yeah, man. I still feel.
I still feel it right now.
I mean, I feel the tape a little bit, but it feels almost like it's still there.
Yeah. Like a stretchy cast. Get back, stand up. Because that one that she put on the spine.
Yeah, like close you.
Yeah.
And the key is that you need to just like each session, if someone doesn't get really better, you dive deeper into the body. Okay. Whereas the inverse right now, it's we test the whole body and we waste a whole hour the first session testing everything. Right, and then we go to the second session and then we're still testing everything rather than just treating. Like sending full force, let's attack it at all angles, and then let's start going down. So then you dive deeper into the body. I would check out your muscle imbalances next. But what if you don't even have to get there, right? Yeah. Like, what if the muscle imbalances aren't the problem? It's that you're always sleeping with this leg up, so this leg's going to be a problem.
Adjustable bands.
Not a fan.
Adjustable bands. Oh, okay. Let's dig into it a little bit.
Our spine is a tree. Right, so if I were to sit on a couch, let's say, if this were like a couch here, to get to the couch, if I wanted to be tree, I'd be here, and I'd be looking up. So to get to the couch, I have to be here, right? Right. So now we're adding, anytime that your knees are going to be above your hips, you're getting a shear force backwards. Mm-hmm. So a disc problem, disc bulge, just right. These are all where you have a donut filled with jelly, and the donut's in the front of my spine, right? And the jelly's coming out with the bulge. So whenever you're here, all that's coming out. But even on an adjustable bed, you're going to prop yourself up here and you're going to get that shear force down this way, and that's also coming back that way. So as long as you don't have pain, not a big deal. Right. But when you have pain, this is the problem that people will go hang out in their adjustable bed more. Yeah. Yeah. So it's a whole cascade.
Vince's big thing when we started the Carnivore Challenge in January was, be nice to yourself and try this. Do something good for yourself. So I would say the challenge for today is be nice to yourself. Watch this a couple times if you have. Yeah. I mean, the first couple times is like drinking through a fire hose. You have so much information. And then buy the book on Amazon. It's called Pain Proof. If you need to help your kids get out of their pain or avoid future pain, get the Pain Proof Kids and just use it as a way to be nice to yourself. You're going to spend more on dinner tonight than you would on these 2 days. Yeah. So, if you want to go all the way, Slight Motion PT at Instagram, and then book an appointment with Dr. Ariana on phone.
Yes. Are the best thing ever. Right. And adjustable. Yeah. Right.
And those are not expensive anymore, right? No.
Right. Yeah. They were adjustable desks.
$80, right? And then you're good to go.
Yeah.
So. Yeah.
I got the little.
Oh my gosh. All right. Thank you so much.
Yes.
We appreciate you.
Teamwork makes a great heart.
Thank you so very much.
Slight Motion PT, a little goes a long way.
A little goes a long way. I love it.
See that? She got her own tagline in. We appreciate everybody for being here. Please don't forget to hit the subscribe button. Share this with somebody because each one of y'all know somebody in pain. So let's go ahead and help them get out of pain. Yeah. Do it the right way. We can work with their brain, let them read the books first, and then if they come on and local, because we don't want them to fly to California. Yeah. Let them go ahead and schedule the treatment there. I'm telling you, just that little bit right there was amazing. So
from Dr. Ariana Fontenot at Slight Motion PT, my big brother Vince, I'm Drew, podcast twins from the Social Arts Studio in Boca are out to you. Out.